All right, I'm good to go, right?
There you go. Yep, perfect.
Awesome. All right, let's get going. Okay, so I don't have any financial disclosures. I thought we would review in my talk commonly used terms on the types of medication options. This is some of the language that researchers and the clinicians may use with you in your visits. And so I think it's good to kind of have that background when we talk about medicines and which medicines are best for you. I would like you to be a little bit familiar with some triptan strategies. We can review some tips that I may have for headache diary keeping, and then really building towards creating your own migraine action plan, which I think is really important to having the best way of treating your headaches, depending on the scenario. So these are the kind of general terms that we'll use. So I added some pictures because I like to talk about how headaches are like a fire, and which medicines and how we choose our medicines is based on managing this fire. So when you have an attack of a headache, we will prescribe medicines that we'll call acute or abortive medicines, and this is kind of like putting a cup or a bucket of water on your fire. And you can use your acute or abortive medicine on a smaller fire, a bigger fire, but think of it as like that starter fire. And then if the fire persists and despite putting some water on it, it's building and growing and it's raging, it's almost becoming a bonfire. This is where the usual acute abortive medicines that your doctor has prescribed really aren't doing it anymore or are helping, but not to the point that it's putting out the fire. Then we think of the next category of medicines, we'll call them rescue medicines. This is what you'll think about sometimes as your emergency medicine when the usual acute abortives are no longer working and you need something stronger to really put out that fire. And then preventive treatments and medicines, we think of this is kind of like your controller med. This is it may be a daily med. It doesn't always have to be a daily medication, but this is something you're making an intentional effort to take or use or be treated with regularly, so that you may not need to use acute abortive medicines as often. And we hope you won't need as your rescue medicines, if anything, for once in a blue moon type scenarios. So the prevention is key because you want it to get to the point that almost it can't start a fire anymore, because you've made that wood just not appealing anymore. There are a lot of acute headache medicine options that we have out there. I kind of put up some of the ones that I commonly use, but there are a lot more out there that probably didn't make my screen here. And there are some new classes that have been emerging. It's an exciting time to be a headache patient because we just have so many new things now, and certainly now in the pipeline that we're hearing about. So lots of options. And so if you're feeling like you don't have an option that works for you, I think it's something definitely to partner with your treating provider, because there are other things out there for you to maybe explore that might work with your medical history. So I always like to spend a moment talking about triptans. I never want to make the assumption that a patient or a family or a physician knows about triptans and the use of triptans. I still find that they're underutilized. They've been out since the 1990s. They can be a very effective medicine. And some people feel, oh, I tried a triptan, and when I ask more information, I'll find out they've only tried one. And I just want you to take away from today that if there's something that is safe for you and is okay, just for you to know that if you fail one triptan, you can certainly try others. And there are 7 in this class. And so we have some patients who've gone from one to another to another. And when you have a triptan prescribed to yourself, sometimes we don't, we're rushed. If someone's giving you a prescription, you don't always go through all these strategies of how to use a triptan. But be aware that you can repeat them safely in about 2 hours. And you want to limit to about 2 tablets or pills a day. And because of medication overuse headache or rebound headaches, we try to limit it to about 2 days a week. Certainly, there's different scenarios where we might extend that or use more. And the commonly seen side effects, most of our patients,
Lauren, you just went on mute.
I did not press mute, so that was interesting. Maybe someone who is moderating press mute. I'm not sure.
Hmm. Okay.
Okay. um, okay, but you can hear me now, right?
Yes.
Okay, awesome. I'm back. Okay, so you can experience dizziness or fatigue is most common, but you can also experience some other flu-like symptoms, feeling nauseous, a worsened headache, muscle aches, feeling flushed like you have a fever. And I do like to warn about the tightness that you could experience where you can feel a strain. It's kind of a strange side effect. You can feel tightness in your jaw, in your throat, your face, and in your chest. And so I think it's really important to tell someone about that because if you've never experienced that or you've been on triptans for a while and no one's ever told you about that side effect and you get surprised when you try it, you can end up in the emergency room and it's kind of a situation where you're like, oh my goodness, I wish I knew. But that tightness, you want to pay attention. Obviously, if it only lasts a brief amount of time, that's more likely triptan side effect, but it's escalating. That is an appropriate reason to go to the emergency room because it could be something more serious. There are a lot of cautions that we have when prescribing or choosing a triptan, uncontrolled blood pressures, heart arrhythmia issues, if you have a personal history of a stroke or heart attack in the past, or if you're currently pregnant. These are things that we might have cautions in prescribing this. And you might have multiple triptans maybe in your medicine closet. You got to be really careful about mixing different triptans in a 24-hour period. And now there's the new class of Gpans, which is really exciting. So you Brevly and Nurtec, great options. You may want to use a GPAN if you've had side effect with triptans or, been through 2 or more triptans, you're not getting the relief that you were hoping for, then GPANs is becoming a great option for patients. But if you have these options, you do not want to be mixing more than one triptan or a triptan with a GPAN within a 24-hour period. You really need to be careful because there's some overlapping way that they act. You could have more side effect. And okay. And so I just put up this is not for you to memorize, just to show these are all the different triptan options. 5 of them are considered fast acting, 2 of them are considered long acting. The long acting ones are naratriptan and frovatriptan. So the strategy with this is sometimes if you've had an unpleasant side effect, it may have been because it was a fast acting, and sometimes they peak at a higher bioavailability or a higher amount in your bloodstream. And so you feel a side effect. It's stronger, it can be faster acting, but if you can't tolerate them, it's not going to benefit you. So if you've been on a triptan in the past and had this unpleasant experience, you may benefit from switching to one of the slow acting triptans. Another time that we consider slow-acting triptans is when you notice you're repeating your fast-acting triptans quite often. So you're dosing it, you dose it again in 2 hours, and you're just feeling it rebounds again. Now, certainly you can switch between triptans, but the long-acting, they're slow-acting, they also may have a longer time period that they're acting. So they're slow to act, not as high a peak, and then they last a little bit longer. So switching to one of the others may help you there too. There's lots of different options. If you look at the available preparations, we've got nasal sprays, melt-aways, tablets. So it's a good conversation to have with your prescriber because maybe the one they gave you isn't fast acting enough and you want to switch to a melt-away or a nasal spray. So things to consider there. I want to put up a slide here because I feel like this is something I'm educating a lot in my own clinic, and there are a lot of over-the-counter combination oral medicines. There also are a few prescription oral medicines out there, and a lot of people are just not that they don't even aware of what's in them. And I just think it's a little bit of a caution because one is that there can be some pretty high dosing of aspirin in these medicines, and another one is there is caffeine in them. So I have patients who are taking, like, say, Furoset, Furinol, taking multiple day and are wondering why they can't sleep at night and why they're having difficulties waking up multiple nights or why they feel more anxious or feeling dizzy, and they're kind of almost leading towards you feeling dehydrated, and it could be from some of this caffeine use. And Furoset and Furinol, in the appropriate scenario used sparingly, can provide amazing relief, and we do know that these combinations, there's a reason that they're putting them together. We have some evidence that they can have help. But butalbital, which is added into Furoset and Furinol, it really doesn't have any additional anti-headache effect. and it is a little bit more associated with developing rebound headaches or medication overuse headaches. So, really just want to be careful with this group of medicines. Just they can help, but just be cautious, aware of some of these potential drawbacks. And as a child neurologist, I definitely need to highlight that some of them, the aspirin, you're really not supposed to be giving aspirin containing products in children, especially under age 15, because there's an increased risk of developing Ray's syndrome. Now, we don't see that much anymore of Ray's syndrome, but that's because a lot of the labels say do not give in children. So I think we've done a better job of avoiding aspirin in children, but it's a serious thing to happen. So, I'm sorry, I didn't realize I had animation here, so I'll just bring it through here. Um, so, um, so taking that through, there are lots of different options, and you start to think, okay, well, when do I use one? And my doctor prescribed this, but when do I move on? And this is how I think of what I'm offering to patients and talking through. So, first step, depending on the severity of your headaches, you may enter at step one. And if you have really severe and high frequency headaches, you may enter at step three. But starting out, we will, I think over the counter analgesics like your Tylenol, your Motrin, even naproxen. I love naproxen, Aleve. These are great first steps and they're available, great things to try over the counter. And it's okay if a provider gives you an over the counter recommendation. It doesn't always have to be a prescription. Step two becomes, I need a little bit more. Maybe the vomiting is intense and I need something to ensure that the medicine stays in my system. And so this is where we start pairing an analgesic, maybe with an antiemetic like prochlorperazine, which is compazine, or promethazine, Phenergan, metoclopramide, Reglan, or another medicine based on some of your other symptoms. So we start to explore combination therapy. Um, and then, there's also the option of going straight to a triptan or a GPAN. These are headache specific medications, or what we consider something designed or research focused. They looked at this to work specifically in headache and migraine. So they're great, and they can also be used in combination therapy too. And then if your acute or abortive medicines are not providing that relief that you're hoping for, then we really need like a step four, which is creating your rescue medication plan. Is that what do you do in the home setting? What are you going to do in the hospital setting? And are there certain things your provider will call in or send you at the emergency, or do you already have available like a steroid dose pack or IM Toradol you could drop for home? Had a lot of great success recently, been prescribing a lot of Zyprexa or olanzapine. So a lot of different options out there, but if it's good to talk through these. And whatever your plan is going to be, it's always important to treat early and repeat as available on the bottles or what your provider recommends. And it's not just all about medicines and choosing the right medicines, thinking about, is aromatherapy, is topical peppermint, medical device. And then, would it help to have a little bit of electrolyte containing fluids during that attack? So, as you're being giving these medicines, your prescriber, your provider may say, okay, can you make a headache diary? It's really important to me, fill this out and bring it back at the next visit. Well, the diary, is really, it's for you to feel like you understand how this is impacting you. How do you feel like the medicines are helping you? Help yourself track this. Is there some strategy that that would emerge or become obvious to the provider if they saw this pattern, and they understand how you're using the medicines? And so, in the diary, I think it's good to talk about or to document your headache intensity. If you can track the days in your menstrual cycle where you have bleeding, they can kind of look to see if there's a period association, and tracking when you decide acute versus rescue meds. I think you could pick a letter to make it easier for yourself, like M every time you take a Maxalt, you can write that to kind of keep that clear. And then whenever there are titration plans or when you start a daily medicine or come off, it's great to just notate that, because then you can look back month by month and understand, what, actually slowly over time there was an increase in my headache intensity and I just didn't realize at that moment. And if it's meaningful in your scenario, is this thinking about when you miss work or school days, just to give that feedback to the doctor too. Sometimes doctors will ask how many school days you missed to document it for their record or for school notes. And just whatever your system's going to be, just try to be consistent. Ultimately, this diary is for you to come to the visit and report back. And it may be that your provider will hand the diary back to you just so you can watch your own comparison. And if you know all this information, don't need a diary, that is okay too. But this is kind of a tool that a lot of patients, especially when visits can be 3 months apart, helps you kind of follow along with what's happening. And so there are a lot of things out there to help people with the headache diaries and tracking this. There are now, multiple smartphone apps out there and available. I think my big caution there is just be careful that you're not getting so lost in the weeds and you're doing so much documentation and tracking of your symptoms. If you have, an established diagnosis, you have history of multiple headaches, chronic headaches, you don't always need to track the location of your pain or the associated symptoms or an hour by hour kind of play out of which medicines you chose and what your headache intensity is, because ultimately we want the big picture to give to the doctor so that they can make the medicine decisions. But if there's so much detail, even you and the doctor can't sort out what the best next step is. So trying to stay big picture is helpful. So at your visits, I think, you got these great medicines. We hope they're going to be helpful. But kind of ask, it's okay to challenge your provider and ask questions. You're giving me this acute medicine, are you giving me multiple? Like, how do I choose which medicine for which scenario? Can I safely take these in combination? Can I repeat them and when? And how do I know when, what scenario or what headache or, when I would want to repeat that? And how long should it be until the medicine kicks in and I notice this benefit there? Is it normal for it to take an hour? And what side effects should I experience? And or I'm feeling really tired. Is this like normal part of this medicine side effect? And the doses per week and things like that. So just you have an understanding of the time the prescription is being given. And preventive meds, like, so, when you come back to talk with the doctor, do you think that that's been helpful? Have you noticed any side effects or maybe symptoms you're not sure are side effects? It's great to bring that to the visit to talk about. And I think it's really good just to always confirm. I mean, we hope that everyone is, doing a medication list with you at every appointment. But with COVID and virtual appointments, sometimes, the medication list is not always done the same format. So I think just making sure you confirm with the doctor what you're taking, the amounts, and be honest about your compliance. I forget 2 days a week. That's important to know and what's happening. And it can get very complicated and people have been on some really long headache journeys. So starting a list that you update from time to time, just adding to the list which medicines you find were helpful and side effects. These are great, especially if you move, you're in new places. I love when patients arrive with like a printed list. It's like great, like we don't have to use the time for me to create the list. I just can put that right into my note and I know we can focus the time on picking the next medicine choices. So then it comes to like thinking more in depth about a migraine action plan during a difficult headache. Some of these tips are tips my own patients have shared with me, but you want to make sure you have access to your medicine. So make sure that you have them on you at the time. Headache, migraine is so unpredictable. And so when is that going to happen? It's just hard to know. And so not being with the medicines at the time that you need them is a big barrier. So if you need to create a migraine pouch or something that you transfer between bags, school bag, work bag, off to soccer practice, wherever it would be, that that you always have this migraine pouch. And some of my patients will purposely split the med so they can have more than one pouch or that they don't have to worry about remembering to bring it with them. They know, like, for instance, at their work desk, they always have the medications available there in a certain spot. So thinking about that. And then it's not just about medicines, like you might be able to might need to have a fluid to take with it. And I think electrolyte containing fluids, Gatorade, Powerade, Pedialyte, it could be low calorie. These are great options to have with your acute medicines. And so A lot of my patients will buy the smaller size bottles that they can put into a bag that it's immediately available for them. And then if you're enrolled in school or your child is in school, you want to make sure you have the appropriate medication administration forms filled out. You don't want a child sneaking in a back corner taking a medicine that no one knows that they're on. They'll wonder what's going on over there. This person's taking a medicine and they don't look well. So definitely want to fill out the appropriate papers there. And then if you're at home or work, like can you create a safe place, a migraine cave, a way that, you can control the sound, the light, maybe a sign that says do not disturb while you're waiting for your medicines to kick in. And, do you have a system set up or thought through, like, who are you going to tell when you have a severe attack? Is something you text a friend or family member? What if you live alone? Is there someone that you want them to know when the headache is getting really bad? And at work, just so they know they can check on you. So, that this is, something that might be severe and caught you off guard. Okay. So when, and you get a little bit more into the details, you want to understand your acute, your rescue medicine plans, and you've done that. You've done that. You're kind of like almost home or school or work plan, but now it's escalating and you need these other treatments that may only be available in emergency care setting, like an urgent care emergency room. So I encourage my patients to think through that worst case scenario. It's not always a great time to think of it when you're at your most severe and your worst because you're not your best. It's hard to think. The people around you are panicked. It's just not the best time to kind of work through the crisis. So consider if you were to get emergency care, where would be the location? Are there certain hours? Like the urgent care may be only in our area, it's only open at nights and weekends, right? So kind of thinking through where you can go and during what hours does that change what you would decide, and the capability. We have some patients that really need the IV medicine option, and we learned certain urgent cares in our region do not offer IV treatments. They only offer IM. So depending on what you need and or your experience of what has worked in the past, it may be something you want to know up front rather than waiting several hours in an urgent care to have to then go to emergency room. And you can create a migraine action plan and have a document that you can share with someone on arrival, and you can have a photo of it on your phone or a paper copy in your wallet, just showing who your doctor is and what your treatment medicines are. So on arrival, the sooner you can communicate that, and a lot of places have migraine plans of medicine mixtures that they will do standardly for all patients. But if you have a tailored plan that works for you and your doctor has already worked that out, then it's best to present that right away, so you can get to treatment faster, which provides relief faster. I have definitely some patients who live alone or who are in school settings or college settings. I think it's great to talk through. Yeah, you want to go to the urgent care, the emergency room, but who's going to bring you there? And figuring out if you cannot drive during a headache, what are you going to do? It could be something you call an Uber, or is there someone else who you can enact to come help you get where you need to go? Um, and recruiting, that's a big thing, is recruiting who those other support members are going to be for these different scenarios. So I've worked together with some different collaborators in adult headache programs, pediatric headache programs, trying to come up with kind of standard migraine action plan forms to start as your kind of a starting point to have with your provider. And so I show a snapshot here. This is readily available. It's published in the Headache Journal, but it's kind of a choose your own adventure form. So you can take this, be inspired with it, or your provider may take this and be inspired by it and kind of alter it and compress it to make it tailored to you. But the big thing is thinking about a form that might have your diagnosis, your usual symptoms. What if you have a wacky visual aura, right? Documenting that so you don't even have to explain it. Someone could just read it and know, wow, that's typical. So that's not her stroke. Yeah, she normally has this. What the clinic contact info is, I have no problem fielding questions from outside emergency rooms if they want to call me directly. So I think that's a great thing to have on there, and certainly home medicines and doses, so you don't have to use your time to communicate that. And then the second page of the form, we thought through when you do go to the emergency room or the urgent care, different medicines and maybe what medications to avoid. I think it's very frustrating if you already know you have a side effect to a medicine or something has been given to you time and time again and it's ineffective. Let's not waste time. Like, let's not give you that medicine that didn't work and keep giving it. So, or you already know that you have an interaction with one of your other medicines, or you don't want narcotics because that has worsened your headaches in the past, or that's a concern there. So having that a list of medicines to avoid is also helpful. So I include this other form that I work together with a pediatric group. This is called the Pediatric Migraine Action Plan, or PEDMAP. And this is similar to the asthma action plan, where it's kind of just guiding you, when is the headache benign and when is it more serious, and when do you need to seek out emergency care, or when do they call an ambulance or call parents. So it's kind of a guiding, not specific in the weeds of always the medicine, but like when do you seek out higher levels of care. And so, just general guidance for parents and supporters of people who suffer from migraine or headache is that, we certainly want to. Oh, I missed a slide here. Oh, okay, there we go. Sorry. Encourage independent management of pain. So, if you're really helpful, if you're on this call and you're the support member for a patient, you want them to have access to their own medicines. You can help them, you can guide them, you can dispense them in pill boxes, you can help them guide through the decision making. But ultimately, you really want to encourage even the adolescent patients to start to have access to their own medicines and be part of that decision making. There's a lot of research that really shows that the more you feel in control of your pain, you may not always feel in control of your pain, but the more we can create the environment where you feel that control, it might actually help your overall pain and the perspective around pain and your pain coping. So try to create that environment, and I do think a pill box is great because it's nice that if you're the reminder to make sure they're doing their daily meds, it's kind of creates this in between where instead of nagging and asking, did you take your med? Did you take your med? Did you take your med? You can just peer in at the pill box and you can see, man, the pills are missing. I know you took it. And it just removes that conversation piece that it's not always a good thing, right? The person on the receiving end is like, oh, she asked me again and I failed, or she asked me again and I did it. Why does she keep asking me? So I think that removes that conversation piece, and that's a helpful thing. So the pill box is something, and now there are even automated pill box machines available where you can program it and dispenses the pill with an alarm. So there's a lot of neat things in that space. Um, and as much as possible, I kind of think of the sport member also as a coach, is if they've had their severe headache, they've taken their medicine, they've waited for the medicines to kick in, and the headache may not have fully gone away yet, but the support member can help coach back to some activity, like, you can do it, how can I help you, can I drive you here, can we get you back towards what you were hoping to do today. And you may not be able to always do everything you'd hope for that afternoon, but trying to do a portion of it is really helpful, because that's also a distraction and may help reduce some of the pain too. So trying to get back as much as possible. And I think it's also an important point as a parent or support member is to just be careful about constant headache status monitoring, especially patients who experience chronic migraines. Like, are you in pain right now? What is the number of your pain? Are you in pain? What about now? Is it better? Is it 1 point better? Okay, is it a 0.5? Because last time you said it was this. You really that's it's not really helpful in the long term, because it's constant reminders. Excuse me, your pain. I'm coughing. Sorry. Constant reminders that you're in pain, and then you create this conversation around pain all the time. It's a constant headache status monitoring. And, a lot of my patients like, you know what? I actually was distracted for a moment and feeling good and was actually doing something fun. Then all of a sudden someone asked me about my pain. And then I go back to that space where I'm thinking about that, my medicines, the things I'm missing out. And it's just not uplifting. So, that's where the log comes into handy, is like, create the log, figure out how you're going to do the log, but you don't need someone constantly asking about your headache. And, it comes down to the conversation and the relationships with people who love you, your supporters. But you don't want it to be the main conversation piece. You don't want it to be the only way a child receives attention or love, or a spouse receives that kind of attention. You want to be intentional about creating other experiences separate from everything being about the pain management, as much of that as possible. So that's kind of my talk there. Excited to hear any questions that you may have when we get to that portion. Thank you
Yeah,
for your attention.
perfect. That was wonderful. So actually, I'm going to ask a question that is kind of directly with what you were just talking about. When you have chronic migraine, how do you know what to record? It gets overwhelming because your migraine never stops. So how do you know what to record and track and that type of thing?
Yeah, and
Especially for disability, like that's
yeah, and also Botox, right? I mean, if people are on Botox, they're asking all these questions at the Botox visits because it's a battle with the insurance companies to keep those the coverage continuing. So my recommendation, and everyone has different preferences. Again, this diary is for you. It's not always about everyone else, but I think monitoring a headache intensity from 1 to 10 every day. I say pick a time in the day, usually it's right before bed, and go, what was the max intensity for the day? Instead of this wavering thing. I mean, that's normal for headache to waver through the day. What's the max intensity? And just every day write that down.
great point. That's awesome because I'm chronic. So that's what I will do. Awesome. Thank you. Um, can you speak a little bit about why a triptan may work for years and then become ineffective?
Yeah, that's a sad question, really. And it's really disappointing when that comes about. And so, I don't think anyone really knows the answer, 100%. I wonder if their disease process has worsened over time, and that maybe they need better controller, better prevention. Some of our younger children, they might have gotten older and gained weight. So we wonder if it's growth or puberty that plays a role, or, going through, your first periods and things like that. I also sometimes wonder if it's weight related. If you gain weight, maybe, we don't always do weight-based dosing in the adult world. We do it in children, but we don't always do it in the adult side. So you wonder, is that something that could be there, either in the actual triptan or in your prevention treatments?
Hmm.
But sometimes it's just, your brain is a fascinating organ, and it evolves over time, and maybe it just doesn't respond to certain medicines.
So true. That makes sense. I'm going to have one more question and then just a quick thing. One more thing. What do you mean by bioavailability? I think you mentioned that in the very beginning.
Oh, that's when you take a dose of a treatment and how much of that from the actual pill ends up in your bloodstream. How much
Oh,
of it becomes available in your
in
biology, kind of think
okay.
about it that way.
Okay, great. Thank you. And then everyone, we loved your map plans and your map plan for your children. Everybody just wants to know where they can find it. I don't know if you can type it in the chat if it's easy to find
I'll put the
that
links
way.
in the chat box. Yeah, no problem.
Okay, awesome. Thank you so much for your presentation. We
Thank you.
loved it.
Thank you.
Yeah.